Hello, thank you for joining us for today's presentation. Today we're going to talk about Medicare Basics and what you need to know. My name is John Mal. I'm with the Gassman Financial Group. We're a New York City registered investment advisory and financial planning firm. So we're going to talk today as an accompaniment to a video that we've already posted on YouTube related to fall open enrollment. We're going to talk about Medicare Basics, and the idea of this video is just to give you the foundational information about the Medicare program that may be very helpful to you in making informed decisions related to fall open enrollment. So a good place to begin is just talking about what is Medicare. So original Medicare, the original program was made up of Medicare Part A and Medicare Part B. It's been added to over time, but these are the core benefits. So Medicare Part A covers hospital, and think of it as facility type of care. So this is care that you're going to receive in a hospital or an institutional setting like a skilled nursing facility. It does cover home health care, and it also covers hospice care. Medicare Part B is really the coverage for your service providers, the doctors, the nurses, the other people that are going to ultimately deliver the care to you. So Medicare Part B covers things like medically necessary services and equipment, x-rays, lab tests, and importantly, it also covers medications or prescriptions that are administered in the doctor's office or in a facility. So Medicare drugs are not only covered through Medicare Advantage plans or Part D, which we're going to get into in a moment, but Medicare B actually covers drugs that are administered by your physician in an institutional setting. So it's important to remember that. Medicare Part A and B come with some costs. So premium-wise, Medicare Part A is free for a lot of people. If you have 40 quarters of qualified work, which comes to 10 years, and you've paid FICA taxes on your earnings, then people generally will receive Medicare Part A, hospital insurance, without a premium. Medicare Part B, in contrast, the base level premium for 2019 is going to be $135.50. It comes up from $134, which was a 2018 rate, and it does increase based on the income-related monthly adjustment amount. So Part B premiums could be higher for some higher income individuals. It could rise to as much as about $460 per month for those with income of over $500,000 a year as an individual, or $750,000 for a couple. So co-payments are another big factor in original Medicare. So in hospital care under Medicare Part A, the co-pays are $0 for the first 60 days, but you can see it adds up from there. $341 for days 61 through 90, and $682 a day for days beyond 90. So that could add up very quickly. Medicare Part B coinsurance is 20% for most of the provided services. And again, if these are expensive services that you're receiving that are administered by your physician, the coinsurance could add up very quickly. And likewise, skilled nursing facilities, days 1 through 20 are free, but days 21 through 100 come at a cost of $170.50 per day. So when people have their care delivered through original Medicare, they're often looking for ways to reduce some of these co-payments and co-insurance charges to make the Medicare program, to limit the total amount that you're going to pay, to limit some of those catastrophic costs that you could incur. So there's a few ways to do this. One is through a Medicare Advantage plan. These are sometimes referred to as Medicare Part C, and they cover the same basic services that are covered under original Medicare Part A and Part B, but they can use some different co-payments and cost structures in order to deliver them. Important to note is that Medicare Advantage plans generally include a prescription drug benefit, so there's no need to purchase an additional standalone plan. And it may include some services that aren't covered by original Medicare. Things like dental and vision are very commonly covered under a Medicare Advantage plan, but they're not covered by original Medicare. So you get some additional services with a Medicare Advantage plan, but you do give up some of the flexibility of original Medicare. Medicare Advantage is delivered through a network of providers, so the Medicare Advantage plan is only as good as the Medicare Advantage network that you're in. So we want people to be sure that all the service providers that they use, as well as the service providers that they could potentially need, that there's adequate coverage in that Medicare Advantage network. Medicare Advantage plans are paid a fee by the government to administer the care. So you'll see a lot of advertising this time of the year for different Medicare Advantage plans because, of course, they want you to sign up for their particular Medicare Advantage plan. So Advantage would be one way of getting Medicare delivered. Again, you give up some of the flexibility of original Medicare. You can't necessarily see any doctor that you want, but in exchange for that, you may get some services that aren't covered by original Medicare, and it generally covers your prescription drug benefit as well. So it's network care, but it generally covers most everything that you would need. For those that prefer the flexibility of original Medicare, they often enroll in a Medicare prescription drug benefit, a Part D plan as well. This is a standalone drug plan, and this is for self-administered drugs, the medications that a lot of us take every day. And these come with a premium. It's a modest $32.50 for 2019, but that again can increase for higher income individuals to as much as a $77.40 surcharge for people with those same high income levels of $500,000 for an individual or $750,000 for people filing a joint return. And with Medicare prescription drug plans, there are some costs that you are responsible for. The deductible, that's the amount that you pay for your drugs. The co-insurance would be the fees, usually a percentage, 20%, 25% of the drug's cost. You'll be responsible for that as a co-insurance charge. And one of the things that comes up very frequently with Medicare Part D plans is a so-called coverage gap, or the donut hole, as it's more commonly known. So it's interesting to note that that's going to be phased out by the end of 2019 into 2020, but it is phased out in 2019 for brand name drugs, and we covered that in our other presentation on open enrollment decisions for 2019. But it's important to note that the donut hole is going away. A lot of people will no longer be subject to that in 2019. But the coverage gap would exist if total drug spending reaches $3,820 for 2019. So that's combined spending, your spending, and the insurance companies. But if it doesn't reach $5,100, that area in between, that roughly $1,200, you would be responsible for 100% of your drug costs. So you can see that that can be really problematic for some people with high drug costs. So it's good to see that that is going away. The prescription drug plans that you purchase, whether it's in a Medicare Advantage plan or as a standalone plan, use a drug formulary. So when you're evaluating your plans, it's very important that you understand how the formulary works. You want to have a list of your drugs and understand whether they're covered by the plan. They may or may not be included in the formulary. And if they are included in the formulary, what tier are they assigned? Generally speaking, the lower the tier, the lower the cost. These are things like generic drugs and preferred generic drugs. The higher the tier, the higher the cost. These are more specialty and brand name drugs. So understanding where your drugs fall into that tier and ensuring that they're covered in your standalone Part D plan or your Medicare Advantage drugs plan is very important, and is something you should review every year. Also beware any restrictions that you might have in your plan, things such as prior authorization for a drug or any kind of quantity limits. You want to understand how that works. And again, you really want to understand how the tiers work, and you want to note any changes that are made to the tiers throughout the year, because you do have an opportunity through open enrollment every fall to make a change to your drug plan or your Medicare Advantage plan. Another thing that people that enroll in original Medicare will often purchase is a Medigap plan. So Medigap plans are designed to work with original Medicare. You would not have one of these if you have a Medicare Advantage plan. And they're designed to pick up the costs that original Medicare assesses, things like those co-payments, those co-insurance charges that you would otherwise be responsible for. So in effect, it helps to limit your catastrophic or out-of-pocket spending with original Medicare. So it covers things like coinsurance, deductibles, co-payments, etc. What's important to note here is it doesn't pay for any benefits that are not provided by original Medicare, so it doesn't pick up things like routine vision or dental coverage that you might get with a Medicare Advantage plan. And it is subject to medical underwriting if you purchase a Medigap plan outside of prescribed enrollment period. So you would have an opportunity to buy one with a guaranteed issue right when you first initially sign up for Medicare, or if you have a special enrollment period. We'll talk about that in a moment. But outside of those time periods, you may not be able to buy a Medigap plan. The rules change from state to state, so it's important to be familiar with the rules in your state. New York, for example, does have guaranteed issue Medigap rights, so New Yorkers have a benefit in that respect. They can change Medigap plans more easily than people in many other states. But be aware of the rules that govern your state, and you can ask for help from your local SHIP counselor. We'll go through that in a moment. That's a great resource for state-specific programs and rules. So the Medigap plan, again, is something that you can enroll in any time, but just, you got to be careful of those potential restrictions as it relates to medical underwriting, and be sure not to sign up during a period where you may not be able to purchase a Medigap plan. So a little bit about enrollment periods. The initial enrollment period is when you're first eligible for Medicare, and that occurs at age 65, so it actually starts 3 months before the month of your birth. It includes the month of your birth, and it extends 3 months beyond the month of your birth. So this is when you're first eligible. This is when a lot of people sign up for Medicare. For those people that have qualified employer coverage, they may choose to defer their enrollment in Medicare Parts A or B. Typically, people sign up for Medicare Part A, but they may decide to defer signing up for Medicare Part B because that, of course, has a premium assigned to it, where A, for most people, typically does not. So they may have a special enrollment period, and that would commence after their qualified employer coverage terminates. They have 8 months to sign up for Medicare Part B and Part D if they've deferred enrollment in that as well. For people who miss their initial enrollment period and don't have a special enrollment period, they can sign up during a general enrollment period. That's from January through the end of March, but they don't avoid any of the late enrollment penalties. So you really don't want to be signing up during a general enrollment period. Ideally, you want to do it either during your initial enrollment period or for those people that choose to work beyond age 65 through a special enrollment period. And this is also when a lot of folks will sign up for a Medigap policy in one of those two initial periods, either the initial or the special enrollment period. So that really is a grounding on how original Medicare works. Again, you can add in additional plans such as a Medigap policy to help to offset some of those costs in original Medicare, or you can take a completely different route from original Medicare and use a Medicare Advantage plan to deliver your care instead. But a lot of the decisions that you'll make during fall open enrollment period really begin with that foundation of knowledge, and then you have a number of different choices that you can make at the end of the year for your care that will begin on January the 1st of 2019. So some helpful resources. You can visit our blog for helpful articles, www.gassmanfg.com. That's GASSMANFG.com. For state-specific rules, you can contact your state health insurance assistance program, your SHIP counselors. They can answer questions related to Medigap policies, for example, and whether you have a guaranteed issue right when you purchase it and what the rules are related to that. And also they can help you with questions related to some low-income programs that might be available in your state that can help offset things like your prescription drug cost or your health costs in general. Medicare Rights Center, they're a terrific resource, 800-333-4114. They They're an advocacy group, and they can answer questions related to Medicare. And also, we encourage people to make liberal use of the Medicare Plan Finder tool at Medicare.gov. This really helps you with your evaluation of Medicare Advantage plans and Medicare prescription drug benefit plans, specifically the prescription drug component of those plans. So the Plan Finder tool, that's a very, very helpful resource for fall open enrollment. And again, we hope that you'll watch our video on fall open enrollment in addition to this video. And if there's any suggestions on future topics that we should cover, please do let us know in the comments section. I want to thank you very much for your time, and enjoy the rest of your day. Thank you.